8:35 right now. So the flu has been lingering longer this season with deadly consequences. In our area, more than a dozen children have died from flu complications, and there are reports of 2 in New Jersey and 11 in New York.
Joining us this morning with more insight on staying healthy and fighting off the flu this season is Dr. Erick Eiting, Associate Professor of Emergency Medicine at the Icahn School of Medicine and Vice Chair of Operations at Mount Sinai downtown. So great to see you this morning, Doctor. Appreciate you being here.
Thank you for having me.
So there's a lot to talk about, too, in terms of the flu, and there's also this other thing going around, the norovirus, the stomach flu, right? So what do we need to know about some of these viruses that are circulating, the stomach bug in particular, right, before we get to the flu deaths?
Yeah, so norovirus is sort of this culprit, and we frequently will call this the stomach flu. It's not flu, it's not the same virus, it's actually a different virus.
Oh, okay, so it's not the same.
Right, and it's also a common source of traveler's diarrhea. And usually the symptoms that we'll see there is it's predominantly diarrhea, some nausea and vomiting. You may have fever, some of the body aches, some of the same symptoms that you would have with the flu, which is kind of where the name stomach flu came from. But so those are the symptoms.
Is there a treatment for it?
There actually is no treatment. And the nice part about it is it's sort of a fast on and fast moving on virus, as I like to think. Yes, exactly. So your symptoms usually are going to start somewhere around 12 to 24, maybe 48 hours after you get exposed. And usually it's going to last no longer than 3 days. Most people, within a day or two, they're feeling a lot better.
But it can get bad. I mean, I hate to laugh about it, but I mean, 13 losses of life. Children. I mean, why is it hitting kids so hard?
Yeah, it's a great question. And so what ends up happening is people who have weaker immune systems can be more affected by this. And there are kids who, because their immune system is still developing, they can be more prone to it. Also, kids just tend to have lots of exposures. Like when we think about going into the classroom or going into daycare, if there's one person who gets sick, it can easily get passed on to other people.
So what should we do as parents?
I think the most important thing is if you're in a situation where you're concerned about your symptoms, you're not able to keep down any food or drink, right? You're not getting out of bed in the day because you're feeling too weak. Those are some of the indications that maybe you need to seek medical attention. But the most important thing is to monitor your symptoms and try to make sure that you stay very hydrated. A lot of people, because their gastrointestinal tract is still irritated, they're still having some nausea and vomiting, eating can be bothersome. So trying to stick to things that are a little bit more bland. Saltine crackers are really great because they're easy for our body to absorb. But making sure that you're staying really hydrated, whether that's with water, something like a Pedialyte or a Gatorade, like those are all going to be keys.
The losses of life in those children, right, the ones that we saw in New York and New Jersey, that was from the flu, like influenza, not the stomach flu, just to be clear, right?
Correct, yes.
Not the norovirus, because there's so much going around right now, right, just to be clear here. So when you are looking at flu symptoms and flu strains, it seems to be, as we said, lingering on well past the normal time. Why is that this year?
You know, it's really interesting. The New York State Department of Health puts out a graphical representation of what the flu cases look like across the state. And what we saw this year was that that graph kind of got shifted just a little bit. And so we were peaking right around the holiday season, right? So right at that same time that we just, we're getting together with family and friends and loved ones and we're celebrating. And so there probably was a little bit more exposure at the time when we were hitting that peak. That's probably a big part of this. It seems like we're heading into a down curve, but it's also been an atypical season, and so that is a big piece. The other part to think about too is, we've seen less people than we typically would getting things like flu vaccines, getting things like their COVID boosters, right? And so for whatever reason, that may be why we're seeing more of a spike this year than what we would typically see at this time.
Is it too late to get a flu shot?
It's never too late. I mean, and actually, so flu season really goes through usually until about March, and because we're seeing so many cases, we definitely recommend that if you haven't gotten your flu shot yet, now is definitely the time to do it.
Is it a wives' tale that the weather, because we're seeing this crazy flow of weather, that the weather makes you sick?
It's not that the weather makes you sick. It's that there are different conditions. So, for example, I'm from Wisconsin, right? And when we have those like frigid days where it's like 10 degrees out and you go out and your nose, it's like everything feels very like dry and congested or whatever, right? So some certain environments can make it more likely to get sick. So it's not so much that the weather gets you sick, but sometimes seeing that wide variation can sort of put people in different exposure categories that makes them more likely to get sick.
All right, Dr. Eiting, thanks so much for coming in. We appreciate it.
Great. Thank you for having me.